Well, good afternoon, everyone. Thank you so much for joining us today. It's my pleasure to welcome you to the April 2021 Epsilon Sigma Phi Professional Development webinar. My name is Jeanette Ray Keywood, and I serve as chair of the Professional Development Committee. If you would kindly take a moment to drop your name and institution in the chat box so we know who's with us today. And we are so happy to introduce our presenter today, Dorothy Nuckols, financial wellness educator with the Department of Family and Consumer Sciences with the University of Maryland Extension. And the title of her presentation is Managing Health Insurance and Resolving Conflicts. Just a couple of housekeeping items before we get started. If you have questions during the presentation, if you would please type them in the chat box. Dorothy will be stopping kind of intermittently throughout the presentation to answer questions. And then at the end, we will also have some time for questions and answers. I just want to let everyone know that our session is being recorded today, and it will be posted on our ESP website within the next week or so. So now, without further ado, I will turn the presentation time over to our presenter, Dorothy. And again, just a reminder, please put your name and your institution in the chat box. Dorothy, the floor is yours.
Wonderful. Thank you, Jeanette. So as you said, I am with University of Maryland Extension, and we were talking about the weather just a little bit ago. It is beautiful here in the Baltimore area. So I have a bunch of meetings this afternoon. I think I'm going to take my laptop out to my deck, and I'll be joining the rest of my meetings from there. So I hope for the rest of you who have nice weather out there, you get a chance to get outside a little bit. So welcome today. During this session, we are going to explore the root causes of health insurance conflicts. We'll talk about what steps you can take to resolve them. But most importantly, we want you to leave the session with a better understanding of how to resolve conflicts overall, especially health insurance conflicts, what causes them, so that you can protect both your health and your finances, because that is what health insurance is all about. So we'll try to make this a little interactive, got a couple of games interspersed through here. So to start with, what are your thoughts on what causes conflicts? Not necessarily the specific conflicts, but what are the root causes of conflicts? What are some of the things that cause conflict, in your opinion? This is not a right or wrong answer. You want to take a moment and put your thoughts in the chat box. I see possession. We all have our own opinions. Isn't that the truth? Disagreement, sure. Different goals, different ideas about resolving conflicts, miscommunication, our own filters. Yeah, lots of great responses. Thank you. Thank you for sharing those. So I found a definition. There's lots of them, but I kind of like this one. I think because I like the way it sounds. So what causes conflicts? And this rationale that I found was mutual optimism, which arises from asymmetric information. And that's really a fancy way of saying we all hope for the best, but we sometimes approach situations with different sources of information, different knowledge bases, and also different potential power structure. And because of that, and because health insurance specifically, which is what we're going to be generally talking about today, does involve some life stressors. Usually it involves health issues, monetary issues, and a power imbalance. It can be very stressful. So we hope for the best. And most of the time, when we submit a claim for health insurance coverage, it works just fine, but sometimes it doesn't. And so that's what we will be talking about now. Is it even an extension program if it doesn't involve an evaluation? This is a pilot program stemming from our health insurance literacy team at the University of Maryland Extension. And I am hoping that she will help us out today. It's not required, but we do have a short evaluation. There are a few questions from the beginning of the program and a few at the end. So there are two ways that you can access this this evaluation. One is if you have a camera app with you, open your camera app with your phone, hold it up to the QR code on the screen and it'll take you to it. And the other is a link which I will put in the chat box, and I apologize, it's going to take me just a moment to get there. But while I'm doing that, I understand that some people may be watching this later, they're watching the recording, and you're important to us too. So if you are watching the recording, I would appreciate it if you would be able to do this as well. Give me just a moment for the links. All right, put that in the chat box. There are a few questions and then there's a stop sign. So stop there, don't close it out, keep your tab open or the app open, and we'll get to the other questions at the end by just continuing past the stop sign. So thank you all who are willing to do that. I'm going to continue on with the program. So let's talk about why health insurance conflict resolution is even necessary. So before doing this program, we did a literature review and we found that approximately 1 out of every 3 patients have received unexpected medical bills over a 2-year period. That's kind of a lot in a relatively short amount of period of time. And over half have tried to negotiate a medical bill at some point in time. So when we did our own research, we did find that in our own study, about 1/3 of study participants have had to appeal a health insurance coverage decision at some point. So even though most of the time with an individual coverage request, everything goes through fine, at some point in time, most of us experience at some point where we have to negotiate a health insurance bill, and most of us are not sure of the steps to take. So today, in this, what we're going to talk about now is exploring strategies to use and manage health insurance to protect both health and your finances. As I mentioned in the beginning, that's really what health insurance is all about. By using our health insurance optimally, it protects both our health and our finances. We'll talk about how to resolve health insurance conflicts and, of course, how to avoid them in the future. And we're going to do that by answering 3 key questions. First is the why. So why do they even happen in the first place? Why do health insurance conflicts happen? We'll talk about the what steps should I take to resolve health insurance coverage and billing conflicts? And then the how can I manage health insurance to avoid conflicts in the future? So that's the ounce of prevention is worth a pound of cure. So how can we prevent them? And throughout this, we'll just talk about some basic conflict resolution strategies because it applies more broadly than just with health insurance. So the first thing we're going to talk about is the why health insurance conflicts even happen. And there's 2 broad categories of reasons. The first is due to coverage. So conflicts happen when health insurance providers don't cover as much as we expect to, and we are subject to expenses that we weren't prepared for or didn't expect. And there are 2 categories for this, the coverage and the charges. So we're going to start with talking about coverage problems. So coverage refers to the services that your health insurance provider has contracted with you to cover. So your health insurance provider agrees through their contract with you to cover certain medical, surgical, and other preventative care, such as prescriptions, sometimes dental and vision services, but not everything is covered by your health insurance provider. So if you expect something to be covered, but it's not, that could lead to disputes over coverage. So why are some claims for coverage denied? Sometimes they're denied because of the treatment, and sometimes it's denied because of something we did or something our care provider did. So we'll get to those 3 areas. But first, we'll talk about some reasons treatment related why a claim could be denied. First is that whatever treatment that we want, whether it's surgical, medical, dental, whatever the category, is simply not offered in our plan. So as I mentioned, not everything is offered, but maybe we want something that's not offered. An example of that is many mental health benefits used to not be covered previously under the Affordable Care Act. Now there's a much broader range of services for mental health benefits. So that opens things up. Previously, there may have been some services that weren't offered, now they are. Another reason why a claim could be denied if the care that we want is considered experimental or outside of the standard of care. So sometimes health insurance covers care that's needed, but not every kind of treatment. So if a method of treatment or a special surgery is considered experimental outside of the standard of care, they may not pay for it. There are times when they may, there are times when they might not, but what makes it experimental? So it's experimental if it's not been fully tested, or if there's another treatment that is considered already the standard of care, something may not be covered by your health insurance company. If you are seeking something that's experimental, but your health insurance company won't provide it, many caregivers can often refer you to a study or some other source of funding for the care that you're looking for. And so that doesn't necessarily close the door, but it may not be something that your health insurance provider will cover for you. Another reason why something could be denied, well, a claim for coverage could be denied if your health insurance provider considers that particular care not medically necessary. And if it's not necessarily required for your health, under their definition, it might be considered not medically necessary. So an example of that could be nasal surgery. If you are experiencing, let's say, persistent migraines, maybe a cure would be surgical and it would be covered. If you don't like the way your nose looks, maybe it's not covered. It would be considered not medically necessary or cosmetic there. One of the most prevalent reasons for a claim being denied is if you sought care and it was outside of your network of providers. So your network refers to the caregivers that have a contract with your insurance company to cover your care. There are several different types of health plans, HMOs, PPOs, EPOs. We're not going to get into the specifics. I would be glad to provide a list of definitions at the end of this program for anyone who wants to send me your email address. But if you sought care out of network, some plans will not cover that care at all. Some may cover a part. We'll get to that later, but we're going to bring this up several times throughout this workshop. Is out-of-network care could potentially lead to your claim for coverage being denied altogether, depending on the terms of agreement you have with your provider. So it's very important when you seek any kind of care that you make sure that caregiver is within your network. Now, we're a multi-state group here today. Some states have different legislation as far as what the insurance companies are required to do if you do get care out of network. So it could potentially differ from state to state. So why are some claims denied? Other reasons, sometimes it's something that we as the patient or the consumer did. If we received our care without having insurance, that might seem obvious, but if we are switching plans and there's a gap in coverage, if we didn't realize that our insurance had expired, or maybe we stopped paying the premiums, whatever the reason is, sometimes this happens where the patient is not aware or they thought they were covered and they weren't. But if someone receives care without actually being covered under that specific insurance plan, that could most likely cause the claim to be denied. Or if in some way during the process we provide false or incorrect information, whether accidentally or intentionally. If it's intentional, that can be considered insurance fraud. So it's very important to make sure that you provide accurate and correct information to your care providers and your health insurance company. And the third reason why some claims can be denied is if there's a clerical error. Now, many of these are easy to correct, but it could be the cause of the initial problem. So there are tens of thousands of medical codes. And if your caregiver entered the wrong code for what you received, that could cause some problems with health insurance claims. And that's just an example. All right, I am going to pause for a moment and first see if there's a question. I do see a comment. Yes, a quote might not cover things like some of the services, anesthesiologists, yes. And sometimes it does seem like you're receiving multiple bills, say for anesthesiology, because you might, part of that may cover lab costs, some of that may cover medical costs, some the nurse, some the physician. So yes, when you look at a breakdown in costs, it can be very confusing. And that's one reason why we have this program. I'm in complete agreement. So what better way to kind of review items on health insurance conflicts than so we will do a quick round of family feud to review the things we just talked about. They are in no particular order because the whole survey was me, our team. But let's start by first question. What are the reasons a health insurance claim might be denied? Give you about 10, 15 seconds and see how many you can put in the chat box real quick as a review, and then we'll reveal the answers. Let's see, out of network, experimental. Procedure not covered. All right, so there we go. Out of network, you got that. Not part of plan, I saw that. Not medically necessary. Experimental treatment. No longer in your health, or sometimes clerical errors. Awesome, great job. All right, so continuing along, we talked about coverage problems. Now we're going to talk about charges. So sometimes health insurance conflicts occur because something may be covered for us. The insurance company pays, but they don't pay as much as we expected, or their charges on our bill, as someone mentioned in the chat just a moment ago, that we weren't expecting. So that is also another broad category of conflicts with the health insurance company. So let's talk about why some of those happen. You will notice there's some overlap. There are some things that cause both coverage and charges conflicts. So one is if you receive care out of network, this is another out of network care problem. Sometimes it is covered under your health insurance plan, but it's not covered as much as if you saw it in network care. So you might be subject to what's called balance billing. So balance billing refers to when the provider bills you for your care and your health insurance company pays the amount that they would pay if you went in network, but there might be more of a difference. There might be you might be billed for more than what a healthcare provider is allowed to pay under your plan. So you might be subject to the difference there. Typically, when a provider is in your plan, there's an agreement between themselves and the health insurance company on what they are allowed to charge. So an out-of-network provider isn't subject to that agreement, and you might be subject to a higher bill amount to pay the difference between what an in-network and an out-of-network provider is allowed to charge. Sometimes there are unexpected healthcare charges because the deductible or your out-of-pocket maximum has not been met. We'll go more into detail in just a little bit about this, but deductible refers to the amount that you need to pay for your health care before the insurance company pays anything. And then your out-of-pocket maximum is the maximum amount that you have to pay each year. And in between that, typically the health insurance company pays some and you pay some. So when you thought you may have met your deductible or forgot that there was a deductible, there are charges that are going to be billed to you that the insurance company is not going to pay because you have not met your deductible yet. And sometimes those plans might have high deductibles. So if you chose a plan with a $2,000, $3,000, $5,000, some of them have $10,000 deductibles, you're actually subject to a lot of out-of-pocket costs before the health insurance company will pay. And that can be a bit of a shock. So that is another cause of conflict with billing. One that many of us don't always think about is medical identity theft or fraud. So that is when someone else uses your identity to seek medical care, and the bills start coming and it's not you. So it's very important that when you receive any correspondence from your provider, from your health insurance provider, that you read everything thoroughly and make sure it's your care and it's your right, your prerogative to check on something that you're not sure of. You might find if you've had care, especially if it's in hospital care where there are often many line items, that something was yours that you just didn't know that it was a separate line item. But medical identity theft and fraud happens fairly frequently, so it is important to check on that. So a couple other reasons. Sometimes they're due to error, and that's often easily rectified. So mistakes happen. They happen due to medical coding, as we mentioned earlier, clerical mistakes, sometimes duplicate or extra charges. Sometimes mistaken identity if you happen to be if you have a more common name, if you're in a family with a junior or senior, if you're one of those, you're probably used to that, but occasionally identities get mixed up. So another reason to check all of your correspondence is to make sure that, again, everything is actually yours. All right, so round two. So the question is, what are the reasons for unexpected costs on healthcare bills? So we'll take a few seconds to let you take your shot at that. See, deductible, not yet. Identity theft. Coding errors. Ignorance. Duplicate charges. Yeah, I think you've gotten just about all of them, not all of them. And so there we go. They are out of network care. So balanced bill. Haven't met the deductible yet. Coding errors, mistaken identity, duplicate or extra charges, and identity fraud or theft. It's a nice going. So we just talked about the why, and I realize I gave you a lot of categories, a lot of lists. So let's talk about the what. What steps should be taken to resolve health insurance coverage and billing conflicts if they should arise? So what do you do first? There's really a couple options. It really depends on your own personal comfort level. There's not necessarily a right or a wrong. You can either contact your health care provider or you can contact your health insurance provider. You can start either way. Part of our research involved having conversations with healthcare providers, and every office that we spoke with had someone who was responsible for the billing and handling basically the back end, office end of their patients' care. And they were all very knowledgeable on handling the health insurance process and were accustomed to working with patients on resolving any issues with health insurance. Many people like to start with their healthcare provider because that's often the face that you know. But you can go right to your health insurance provider. Most of them have multiple ways that you can contact them on many sources of information. So a good practice is to carry your health insurance card with you at all times. And on that card is contact information for your health insurance provider. Most, if not all, have a website. Many of the websites have a chat bot if you're used to using some of those, where you can handle questions using chat directly with your insurance company. So there are often many ways that you can handle health insurance conflicts. So Most of us don't realize this, but the health insurance providers have to actually inform you in their contract of how you go about handling disputes with them. So where is that found? If you are looking for information on what to do if you do have a coverage or a billing conflict with your health insurance provider, it's found in your evidence of coverage. That's the contract you get typically when you sign up for insurance. Often at insurance renewal, you're sent a new evidence of coverage. It is fairly lengthy. I know mine's over 100 pages, so it's not easy reading, but in the table of contents, there's a listing for what to do if you have a dispute with your health insurance provider. If you don't have a paper copy, your health insurance provider should have this online at their website. So it's always good to take a moment and just see if you can find that, either your paper copy, keep it in a place where you can find it. The important thing about the evidence of coverage beyond just what we're talking about today is it really has everything you need to know about your health insurance plan. Usually right in the beginning is a chart, a page or two of charts that tells you in categories what items are covered by your health insurance company, what the percentage deductibles and co-insurance payments are. So it's a good resource to have, or to know where you can find it online. So let's talk about the steps for filing a health insurance claim and going through the appeal process. So the very first step, of course, when you have care, is to file the claim itself. And the claim for care can be filed before you have the care, so pre-approval, pre-authorization, or it can be filed after. Most of the time, that is done by your provider. But there are some providers who hand the patient the paperwork and have you connect directly with your health insurance company. So most of the time, that's not a process that you do. Most of the time, it's the provider. So step one, file the health insurance claim. Most of the time, the health insurance provider approves the claim and it's seamless. But this program is because sometimes they deny the claim. And so if the health insurance provider denies the claim, they must do so within a certain number of days. So there are a bunch of days written on the screen in front of you. If you have not had the care yet, they need to inform you within 15 days in writing. If you've already had the care, in theory, it's not as urgent of a response time, so they have 30 days. If it's an emergency, they have 72 hours to respond. So 15 days if it's before, 30 days if it's after care, 72 hours in the case of emergency to provide a written claim denial. If your claim for coverage is denied, you can file an internal appeal. That means using your health insurance provider's own appeal process within the company. So they review it. They have a department who will review it. If you have not received care, they have 30 days for the internal appeal. Or if you've already had it, they have 60 days. Now, what if you still are not satisfied with the answer and they still deny your coverage request? Every state has a slightly different process, but you then have the option for an external review. That's an external review board that's autonomous from the health insurance provider. If your provider denies your internal appeal, the denial has to be in writing and they have to give you the steps, the instructions on how to file an external review. So because it can be different in different states, I don't have the specifics here, but in the written denial from your health insurance provider, they have to tell you the steps to file an external review. And the external review process can take up to 60 days, whether or not you've had care, except if it's urgent. In the cases of an emergency or urgent care, they have 4 days. So I'm going to pause here. Does anyone have any questions at this moment? So I do see a question on how I got the Family Feud game and how I got it to work. I'll tell you what, I will provide my email address and maybe we can just chat offline a little bit. Be happy to show you. I've enjoyed using it. I've used it for a few programs. All right, so moving on from this, then I see no immediate questions right here. And I will take them at the end. Let's get to the how. How can health insurance be managed so that conflicts can be avoided in the future? So most important, check your provider network. Before receiving care, check your provider network. Make sure that the hospital, the provider, whoever you're seeing is in your network. A common issue arises, and someone brought up anesthesiology earlier. Sometimes some of the providers that you don't necessarily see face to face are where the out-of-network problems occur. So if you go to the emergency room and you see a provider, a primary care physician that's in your network, but they send you for x-rays or they send you for pathology reports. If that provider is not in your network, that could lead to some of the problems we're talking about. So it's important to self-advocate and make sure that wherever you're being sent, that provider is in your network. And as I mentioned, different states have different laws and regulations covering emergency care. So another way to avoid it is to get an upfront estimate of cost or pre-authorization. Now, humans aren't machines. So often if you get a cost estimate, it can't be exact because it's hard to know exactly what type of care is going to be needed or what's going to happen once, depending on how complex your need is. But it can at least help, or you can get your provider to do a pre-authorization with your health insurance provider if there's questions about coverage. Another is to review the evidence of coverage. That's that booklet we just talked about, that agreement for covered services. So check beforehand to see if something is or is not provided. There's some things that they very specifically will list as not being covered to avoid that surprise later. And then check pre-approval requirements. So that's a little bit different than the first item that I had there. Check your network, but some healthcare systems, some health insurance systems require pre-approval, pre-authorization if you see a specialist, for example. So a health maintenance organization, HMO, usually does. If you have a PPO, a preferred provider organization, they usually don't, but it's still important to see someone that's in your network. But do make sure that if you need pre-authorization or pre-approval that you get it, because that could potentially lead to issues down the road if you don't. You can file a claim before receiving care. We talked about the steps just a moment ago. You file the claim with your health insurance company or the provider does. Most of the time it's the provider. Receive your approval or denial and then go through the process. But you can do those steps before receiving care if possible. We talked in the earlier part of the program about how not having met your deductible could be a problem. So I'm just going to go through the steps of what that means. So another action to take in order to be prepared to pay for your out-of-pocket. Another step to take to avoid conflicts is to be prepared to pay for those out-of-pocket expenses. Almost every policy holder will have some sort of deductible, an amount that you need to pay yourself before the health insurance provider pays anything at all. There are some services that are often covered without being under the deductible. So sometimes preventative care, immunizations, that's a big topic now. Often those are provided without cost, without having to meet your deductible, but it's good to check first. So the deductible is the amount that you need to pay out of pocket before the insurance company pays anything. Then as you look at the illustration of the bucket, the analogy of the bucket, there is some time during the year where you've met your deductible, but you haven't paid your maximum for the year yet. So in that time, your insurance company will pay Usually most of your costs, usually anywhere from 60 to 80 to 90%, depending on your policy terms, usually around 70 to 80%. Or sometimes it's in dollar terms, they'll pay $70 out of 100, for example. But during that time after you meet your deductible, usually you pay some and your health insurance provider pays the rest. Until you meet your annual out-of-pocket maximum, and then it resets at the end of your plan year. Most plan years go January 1st to December 31st, but be careful, there are some plans out there that don't, and that can be confusing as well. Some have a different plan year. So be prepared to pay those out-of-pocket costs. So we're going to kind of wind down with some insurance management strategies to avoid disputes. They are to keep all your health insurance papers organized. And this really we can think about being more broadly applied to other areas outside of health insurance. Keeping documentation of any sort for related, important related matters is helpful for avoiding and resolving conflicts for that down the road. So keep your important documents, in this case, your health insurance papers, organized, and whatever system works best for you. So there's no right or wrong system, but having a system where you can identify and find things is helpful. The second is to budget for costs related to that item, in this case, health insurance. So budget for the deductible and out-of-pocket maximums. That gives you the confidence to go and get that care that's needed when you need it. So if the money is there in savings, it kind of helps us avoid the stress of wondering if we can get the care that we need. So budget for the deductible and out-of-pocket maximums, track the healthcare expenses. That way you know when that deductible's been met. And that way you also know if expenses are yours. And then have your evidence of coverage where you can find it, or the website bookmarks. So in some way have that documentation from your health insurance provider in a place where you can find it. So some dispute resolution strategies. And again, these are listed specifically for health insurance, but they can really be applied more broadly. So document all communication in a way that works for you. It can be a short note, in whatever way you communicate, keep it with your documents, but the date, a name of who you spoke with if possible, generally what you talked about. If you want to get very specific, you can do that, whatever way works best for you, but document so that you remember what was said and when. The second one is before handling a conflict, write down what you want to say and try to remain calm. We're all human. It's easy to forget some important things. It's easy to forget some things that we want to say when the situation is stressful. So to keep things a little bit less stressful for yourself, if you have written down what you want to say, it's easier to remain calm and to make sure that you cover everything that's important and in a way that you want to say it. It just helps us to have a little more control over the situation. And third, ask your healthcare provider for assistance with health insurance disputes. Most of the time, your provider is more than willing to help, and they're used to this. They know the steps and they know the process. And so we have a list of reliable resources that we can share. If you go to, if you Google University of Maryland Extension, Insure Your Health, you will find our health insurance literacy page, and there is a broad range of resources there. Healthcare.gov provides a lot of information on health insurance, your rights and things like that, as well as Consumers Union. That's the next one on the page. And then another helpful website is the CMS, the Centers for Medicare and Medicaid Services. And I am going to circle back to that end of the evaluation. If you could reopen that web page, that tab, that app on your phone, whichever way you use to access it in the beginning. I will put the link back in the chat box. You either weren't able to start it or you lost it, but hopefully you still have it because it's the pre and the post is on the same one. So that's there. And it would help me a lot. It would benefit our research if you are willing to complete the evaluation for us. Share your thoughts. And that is everything I had to share with you. So are there questions? And I will also, that's my contact information.
And you can unmute yourself and ask your question live or type it in the chat box. And we did have a question from Amy, or asking for some advice from Amy. Dorothy, can you
I think I just found it. Thank you. So just scrolling up to the questions. So Amy said in the chat box that she's been charged out of network, even though you were in network. Let's see.
Yeah, it's been It's been really tricky because I was in network and it's still now who I see in network, but they're just convinced that for whatever reason it was considered out of network that time. And so I've made several phone calls to the doctor's office and to the insurance, and I just can't get anywhere. So I don't know what to do.
Okay, so you've tried, that's what I was going to ask, if you've tried both health, that's just an oddball situation. So I would next I go to the Consumer Protection Agency in your state. They usually have a way to file grievances with that. Typically the health insurance claim process that I mentioned is if they deny your coverage altogether, but if you check your evidence of coverage, that document, they may have buried in there some piece of information on specifically what your avenue of redress is in your particular situation. No, typically the next step is to go through if they still deny it, is to go through the insurance oversight board in your state.
Okay, and so that's just Google Insurance Oversight Board for Oregon.
It's either that information might be in your evidence of coverage, and it might not. So yes, that's what I would check the evidence of coverage. If you don't see it there, then I would just Google it for your state. Yes.
Thank you.
Yeah, thank you. Sorry about that. I mean, when I do this, there are almost always some very specific situations that.
So Dorothy, someone was asking if you had any current statistics about the amount of identity theft tied to medical claims and NCF.
I don't. That is a good question and an interesting one, and I'm going to write it down. I don't have that, but I will check into that.
And Sandra had a question about how do you handle personal stories? Many times conflicts are detailed and messy, and to kind of, I guess what you're asking is maybe maintaining the confidentiality of the situation. Do you have a way of handling those personal stories or those personal issues that people are facing? Sandra, did I get that question? Am I interpreting what you wrote correctly? If not, please feel free to turn on your mic. And
there are a couple things. I guess one is we don't necessarily have the resources to necessarily investigate we try to provide the direction that someone can go in and the resources they can check on, but typically can't get too detailed or too detailed about personal situations. However, as far as in the workshop, I've had people send me private messages or emails after it's over, and if I can point someone in the right direction, I will. But as far as specific one-on-one guidance, that can be a little trickier. I hope that answered that. So I do see if my name is not spelled correctly on the bill, am I still responsible for paying it? I would say if it's your expense, then yes, but you probably want to get that corrected. I know I experience that a lot. So you can see my name on the screen. I get it spelled like with a K, K-N-U-C-K-O-L-S, E-L-S. I get it spelled all kinds of ways. But yeah, if it's your service, then yes, I would say you're responsible for it. Sorry. I would have loved to give you happier information.
Other questions for Dorothy? Again, as you can see, her contact is on the screen, and we'll drop it in the chat box to make that easier if you want to connect to it that way.
Sure.
But one final call before we wrap up today's session. With any final questions?
Thank you, everyone, spending this afternoon with us, and hope you get a chance to get out and enjoy it if it's sun shining, and even if it's not.
Well, and I would like to reiterate by thanking Dorothy for this very informative presentation, very interesting and informative. And thank you to each of you for attending this webinar. As I mentioned earlier, the webinar, a recording of it will be archived on the ESP website. It will be up within the next couple of weeks. And we hope that you will consider attending webinars in the future. We do have them on the 4th Tuesday of every month at 1 o'clock Eastern Time. And our next one will be Innovative Methods to Evaluate Higher Learning by Youth. But when you go to the ESP website under the webinar tab, there is a schedule of upcoming webinars and the link to registration. Thank you again, Dorothy. Thank you to all of our participants. Have a wonderful afternoon and enjoy your day.
Oh, I do see a question about the survey. So if you just started the survey, you do the beginning and then just continue on to the end. So go on past the stop sign and finish it up. Thanks. So it's a pre-post all in one.
And if you have other questions, please stay on, and Dorothy will be happy to answer them.
I can stand a little bit longer. Thanks, everyone. Thanks for the positive feedback. I appreciate it. And thank you, Jeanette, for hostessing.
My pleasure.